Western Cape is now the new COVID-19 epicentre. The province has the highest number of both infections and deaths to date. It's now surpassed Gauteng with 1,279 infections and 28 deaths. The country saw a jump of 318 new cases and 10 deaths. Well, to discuss this now, I'm joined by Dr. Melinda Suchard. She's head of the Centre for Vaccine and Immunology at the NICD. Dr. Suchard, good morning and thanks so much for your time. So what explanation possibly could we have for what has happened in the Western Cape? Now, why we're seeing the increase in numbers of infections and deaths?
So I don't have a detailed analysis for you on the Western Cape, but what was mentioned in the minister's letter was what sounds like common source outbreaks. People who are working in the same environment, for example, in a factory, where we see many infections can result from one or possibly more infected individuals. And we've seen similar things happen in other provinces. For example, one funeral can result in many cases. So in a way, it's not a surprise. We are expecting that as time goes on, the cases will continue to rise, and we will see certain infections and certain clusters in different areas. And really the challenge is to react very rapidly to those clusters and to those hotspots of infection.
Is there anything in particular, though, about the Western Cape, the makeup of the Western Cape, maybe the quality of health service, that might provide some kind of answers?
I'm not sure exactly on the cases in terms of which sector they were in. We know the Western Cape had travellers at the initial stages of infection. So the Western Cape has been involved from the beginning. This is not an infection that we are aiming to eliminate, meaning we cannot aim to get rid of COVID-19 from the country. Really, we can just aim to control clusters of infection and the rate at which they spread. So in certain respects, it's not surprising that the provinces who had early infections will continue to see cases.
So is this not something that we should be terribly worried about? Are we to expect that the epicentre of this pandemic in the country might change from province to province or city to city at any given time?
Yes, I would say that's a reasonable expectation, because it depends on how stringently lockdown measures are in place. It depends on really where the virus is at any particular time, and we can anticipate that the virus will move. And any particular hotspots of infection are likely to give rise to more cases within that area until such time as the social distancing measures and lockdown measures can bring that hotspot under control. And then it's likely to flare up in a different area. So the detention will have to move.
So, Dr. Suchard, what do we do then? I mean, what would be your advice to health authorities in the Western Cape at the moment?
Really, the advice is the same as it's been. It's about maintaining the rules of the lockdown and maintaining social distancing and hand hygiene when one is out doing the food shopping. That is the way to prevent the infection spreading and certainly to control the rate at which it's spreading.
Can I just get your general opinion on what we heard from the President last night, the level 4 lockdown that the stage that we're expected to come into effect next week? Just, are you at all, what are your concerns about that? What worries you, or are you feeling a bit more optimistic? Just some idea of, especially you from the NICD.
I think it's an optimistic move. I think it's a very measured response. We are all hoping to be able to come out of lockdown. And really what the President has told us is that we are going to start that process, but we are going to slow. So we are going to take a very measured approach to coming out of lockdown. And he did mention that if the virus starts moving too fast again, that future lockdowns might be on the cards. And we don't want a future hard lockdown. So it's good advice. It's a good strategy, and we hope to see that we can keep the virus under control at level 4 so that we see further improvements in the levels as we go forward in the weeks.
He spoke about certain businesses having batches of workers come in particular shifts. He spoke about the gradual phasing in of schooling as well. So we will see movement there. But are you particularly worried about any sector then, or are you confident that South Africans have a handle on this? We know what to do. We know the sort of precautions that we need to take, and that we've gotten good at it.
I think the onus is on each and every business, as they are allowed to open up, to really take their own initial individual hard look at their business and put in place measures that can control any spread of infection at their own workplaces. This is not something that can always be imposed for every particular situation, every particular small business. And really, it will be up to us once again to make sure we manage the process individually as best we each can.
What will you be looking out for as the NICD once this comes into effect, level 4? What are the things, what are the signs you're going to be looking out for to see whether we have to take a couple of steps back or we can move to the next phase?
I think the NICD is hoping to have a good handle on geographically where is the virus and where are the hotspots, so that if there are any harsher measures that need to be implemented, for example, escalation to grade 5, back to grade 5, that we can then perhaps institute them locally. And the President did mention in his speech that individual provinces and even individual districts or metros might have their own different level from what is a national level. And I think that will be the challenge, is trying to react quite fast on the ground to particular geographical areas so that the whole country hopefully can avoid another hard lockdown.
All right, well, thanks very much for that expert advice, Dr. Melinda Suchat from the NICD there. Well,